Okay, so we've got a ton of stuff to dig into today.
Yeah.
All about this nursing shortage that's, kind of rocking the boat for healthcare here in New England.
Right.
We've got market analysis. We've got wild new ideas for staffing.
Uh-huh.
We're looking at how to keep the costs down and plan for the future.
Yeah. It's all here.
And, of course, we can't forget the data part of it all, right?
Absolutely. Data's key.
And even how to work with staffing agencies. So
Right.
our mission, if you will, is to, break it all down, give you the big picture of what's going on and what some smart solutions might be.
Yeah. And to make sure that we don't overwhelm anyone.
Exactly. So are you ready to dive in?
Definitely. Let's go.
Okay, so one thing that jumps out from all of this material is that this nursing shortage thing, it's not, just a temporary blip.
No, it's not going away anytime soon.
It's like a fundamental shift, a change, especially here in New England.
Right. What we see consistently throughout all these sources is that this isn't just a temporary hurdle.
Right.
We're talking about a major evolution in healthcare.
Totally. It's not like we're just waiting for things to go back to how they were.
Right, exactly.
Because that's just not realistic anymore.
No.
So a big piece of this, and this comes up in everything we're looking at, is the whole demographics thing.
Huge factor. Yeah.
We've got a growing population of older folks who need more health care, obviously.
Of course.
And at the same time, a lot of our experienced nurses are, getting ready to retire.
Yeah, makes sense.
And then you look at those projections from the Bureau of Labor Statistics. It's like, wow.
It's kind of mind-blowing, isn't it?
It's a lot of job growth predicted in nursing.
Right. It really highlights the scale of the problem.
It's a real imbalance, right, between supply and demand.
Exactly.
And here in New England, it's not like every area is being hit the same way.
Right. That's an important point.
The materials point out that those big urban centers, they tend to have an easier time attracting nurses.
Yeah, maybe because of more opportunities or...
Better pay, who knows?
But that can make things even tougher for, say, a hospital out in a rural part of Maine.
Absolutely. You can't take a solution that works in Boston and just plop it down in northern Maine.
Exactly. A one-size-fits-all approach just doesn't cut it.
Nope.
And then on top of all that, we've got the issue of specialization, right?
Yeah, absolutely.
Your sources specifically talk about critical care, the ER, perioperative care, and psych nursing.
Right. All facing massive shortages.
It's not just that we need more nurses overall. It's that we need more nurses with very specific skills.
Exactly. Highly specialized professionals.
So what we're seeing is that some of these, forward-thinking healthcare organizations, they're not stuck in the past,
No, they're embracing the change.
They're getting creative, trying new things to staff their facilities and make things work.
They're coming up with some really innovative solutions.
Yeah, so let's talk about some of these new ideas.
It seems like the old model of everyone being full-time employees, that's fading out a bit.
Yeah, it's not as rigid anymore.
One of the things that keeps coming up is this hybrid staffing model.
Right. So hybrid staffing is really about building a more adaptable workforce.
Okay, how so?
So you've got your core team, your full-time nurses who provide stability,
Right, the foundation.
Exactly. Consistency in care, and they really know the ins and outs of the facility.
Yeah, that makes sense.
But then you supplement that core with per diem and contract staff.
So folks who aren't there all the time.
Right, exactly. They come in when you need extra hands, like if there's a sudden influx of patients.
Like a surge in admissions.
Yeah, or maybe someone's on leave, or you need a specific skill set for a short period.
I see.
It's about balance, really.
Okay.
Keeping a stable workforce, but also having the flexibility to respond to changes, and keeping an eye on costs, too.
It's like having a strong base, but with the ability to, scale up or down as needed.
Exactly.
Another idea that came up a lot was cross-training.
Yeah, that's a good one.
So is this about, expanding what your nurses can do so they can work in different units or specialties?
Exactly. You're investing in training so your nurses can be more versatile.
So if one unit gets slammed, you can pull in a nurse from another area who's trained to help out.
Yeah, that's the idea. Of course, it has to be done carefully.
Right.
You need the right training resources in place.
And I imagine nurses need to feel confident.
Absolutely. They need to feel prepared and supported when working outside their normal area.
Yeah, I bet you could get some pushback if you're just throwing people into new situations without proper training.
Oh, for sure. That could lead to some serious problems, both for patient care and staff morale.
So another model we saw was team-based care.
Right. That one's about maximizing the use of your nurses' skills.
Okay, how does that work?
It involves taking a really close look at all the tasks that happen in a unit and then figuring out who's best suited for each one.
So kind of dividing up the work based on expertise.
Exactly. You want your registered nurses focusing on those highly skilled clinical tasks.
The things that require their specific training.
Right. And then other tasks, maybe less specialized ones, those can be handled by support staff.
Okay, so it's like a division of labor.
Yeah, you could think of it that way.
So it frees up those RNs to really focus on what they do best.
Exactly.
And then we have the idea of internal float pools.
Yeah, kind of similar to using agency staff, but with some key advantages.
Okay, tell me more about that.
So a float pool is a group of nurses who work directly for the hospital,
Uh-huh.
and they're trained to work in multiple units within that facility.
So they're like in-house reinforcements.
You could say that, yeah.
And why is that better than just calling up an agency?
Well, because they're internal staff, they're already familiar with the hospital's policies, the procedures.
You know, the culture.
Exactly. So it can mean better continuity of care compared to relying on external agencies.
Makes sense.
It does take some investment up front, though.
Like in training and development.
Yeah. But in the long run, the sources suggest that it can be more cost-effective than constantly using agencies.
So we've been talking a lot about different staffing models.
Yeah.
But of course, we have to talk about the elephant in the room.
Cups.
Exactly. How can hospitals deal with all this, without breaking the bank?
Right. Well, the materials highlight several important strategies.
Okay, let's hear them.
The first one is all about data-driven staffing optimization.
Okay, what does that mean?
It means moving away from gut feelings and using herd data to make decisions.
So like actual numbers.
Exactly. Things like patient census, how many patients are in the hospital, acuity levels, which means how sick the patients are,
Okay.
admission and discharge patterns, even seasonal variations.
Wow, so a lot of factors.
Yeah. By crunching all that data and using sophisticated scheduling tools,
Uh-huh.
hospitals can create efficient staffing plans that ensure proper coverage.
Without just throwing extra nurses at every situation.
Right. It's about being strategic and avoiding unnecessary costs.
So it's like being proactive instead of reactive.
Exactly.
And then there's the whole issue of overtime.
Yeah, that can be a real budget killer.
I bet. And I imagine nurses get burned out if they're always working extra hours.
Absolutely. That can lead to lower quality care, too.
So what's the solution?
Clear policies, for one.
So everyone knows the rules.
Right. And you have to monitor overtime usage, figure out why it's happening.
I see.
Sometimes it's actually cheaper to use agency staff for specific shifts than to pay existing staff overtime.
Interesting. So it's not always as simple as just avoiding agencies?
Nope, it's more nuanced than that.
Okay, so what about the agencies themselves?
The sources talk about moving away from just using them in emergencies.
Right, like when you're totally desperate.
Exactly. Instead, it's about building more strategic partnerships.
Okay.
Working with a select group of agencies, maybe committing to a certain number of hours, planning ahead whenever possible, even setting performance standards.
So it's more of a collaboration.
Exactly. It can lead to better rates and more reliable service.
Makes sense. Now, the material also talks about making smart investments up front.
Yeah, things like sign-on bonuses or retention programs.
I can see how that might seem expensive at first.
It can. But if you think about the constant churn of hiring and training new nurses,
Yeah.
it often makes more financial sense to keep your existing staff happy.
So you're investing in stability.
Right. And the sources really emphasize the importance of understanding turnover costs.
What does that mean?
It means calculating how much it actually costs to lose a nurse and then hire and train a new one.
Oh, I see. So you can justify those upfront investments by showing the long-term savings.
Exactly.
Okay, so we've talked about addressing the immediate need.
Yeah.
But what about the bigger picture? The future of nursing in New England.
That's where long-term planning comes in.
Yeah.
The sources really emphasize the importance of building pipelines for future nurses.
So making sure there's a new generation ready to step in.
Right. That means partnering with nursing schools.
Like offering clinical rotations for students.
Exactly. Or faculty practice arrangements, maybe even tuition assistance programs.
So you're investing in their education.
Yeah. It might not pay off immediately, but it's crucial for a stable workforce down the line.
And I bet those students are more likely to stay on after graduation if they've already had a positive experience at your hospital.
Absolutely. It's about building relationships and loyalty.
Okay, so what about keeping those experienced nurses we already have?
Well, that's about creating clear career paths within the hospital.
So showing them they can grow and advance without having to go somewhere else.
Exactly. Things like clinical ladder programs where nurses can gain more expertise, or specialized training tracks that allow them to focus on specific areas.
So you're saying it's not just about the money, but about showing them they have a future at your hospital.
Right. People want to feel valued and know they have opportunities to grow.
And speaking of feeling valued, we can't forget about workplace culture.
Huge factor in both retention and recruitment.
Yeah, I could see that.
The sources make it clear that hospitals with positive work environments have much lower turnover.
So it's about creating a place where nurses actually want to work.
Exactly. That means investing in leadership development, making sure managers are supportive, improving communication channels, recognizing nurses for their hard work.
Creating a positive atmosphere.
Yeah. When nurses feel appreciated and supported, they're more likely to stay.
Okay, so we've talked about people. Now let's talk about technology.
Okay.
Obviously, technology can't replace nurses.
No, but it can make their lives easier.
Right. So things like electronic health records, those
Yeah.
are becoming pretty standard.
Yeah. And good communication platforms, tools that streamline workflows.
So anything that takes some of that administrative burden off their shoulders.
Exactly. But the key is to choose and implement these technologies carefully.
Yeah, I can see how that could backfire if it just creates more work for nurses.
Oh, absolutely. It has to be done thoughtfully.
Okay, so we've talked about a lot of different strategies,
Yeah.
but one thing that keeps coming up is the importance of data.
Data is everything in this situation.
Right. We can't just rely on gut feeling or anecdotal evidence.
Nope. We need hard numbers to make informed decisions.
So where do we start?
Well, with vacancy metrics, for one,
Okay, what's that?
it's analyzing your staffing gaps in detail.
So not just saying, we need more nurses.
Right. It's about looking at which units are short-staffed, which shifts are the worst, even what time of year you see the biggest shortages.
So you can target your efforts more effectively.
Exactly. Instead of a broad statement, you have a specific need, like, we're short on critical care nurses on the night shift during summer.
Okay, that's much more helpful.
And then there's turnover analysis.
So figuring out why nurses are leaving.
Exactly. Are certain units having more turnover than others?
Right.
Are there patterns related to how long nurses have been working there? What are people saying in their exit interviews?
That can tell you a lot about what needs to change.
Absolutely.
And of course, we can't forget about patient care.
Of course not. That's the priority.
So things like infection rates, falls, medication errors, patient satisfaction
Those
scores.
crucial indicators.
If those start to slip, it could be a sign that staffing is impacting quality.
Exactly. You need to catch those problems early.
Okay. And then, to bring it all together, we need that financial perspective.
The bottom line, right.
Exactly. We need to understand the real costs of all these decisions,
Not just the immediate costs like overtime and agency fees.
but also the long-term financial impact.
Exactly. The costs associated with quality issues, recruitment, the overall effect on operations.
All of it.
That comprehensive view is what helps justify investments, both short-term and long-term.
So one final theme that really stood out was the value of strategic partnerships with staffing agencies.
Yeah, it seems like those relationships are becoming more and more important.
It's not just about calling them up when you're in a bind.
No, it's more than that.
They have a lot of expertise in healthcare recruiting.
They do. They know the market. They have access to a wider pool of candidates.
And they can connect you with nurses who might actually prefer that kind of flexibility.
Right, people who might not be looking for a traditional full-time job.
So you're tapping into a different segment of the workforce.
Exactly.
Now, I know some hospitals are hesitant to use agencies because of concerns about quality and consistency.
Yeah, that's understandable.
But it seems like those concerns can be addressed by building strong relationships.
Absolutely. When you have an established partnership, you often see the same agency nurses coming back.
So they get familiar with your hospital, your staff, your procedures.
Exactly. That can really improve continuity of care.
And as we talked about earlier, those established partners can also be there for you in a pinch.
Right, when you have an unexpected surge in patients or something.
So it sounds like there are a lot of moving parts to this whole nursing shortage issue.
It's complex, that's for sure.
But if we had to boil it down to the key takeaways,
Okay.
it seems like it's about understanding the changing landscape of healthcare.
Absolutely.
Embracing those new flexible staffing models,
Yeah.
being smart about cost, using data to make decisions, building strong relationships with agencies,
Right.
planning for the long term, investing in education,
Yeah.
and creating a positive work environment.
And never forgetting about data-driven decision-making.
Yeah, exactly. It's about adapting and innovating, not trying to go back to the old ways of doing things.
I agree. It's a challenge, but with the right approach, hospitals can create a stronger, more sustainable nursing workforce.